Today we are going to see about breath malodor. What is breath odor? It is defined as a subjective perspective after smelling someone's breath. It can be pleasant, unpleasant or even disturbing. If it is unpleasant or disturbing, it is named as bad breath, malodor and halitosis. So in this video, we are going to see what is halitosis, types of halitosis and how can we identify it and why it is caused so and the solution for it. There are three main categories, that is genuine halitosis, pseudo-halitosis and halitophobia. Where genuine halitosis is a term used when the breathing malodor really exists and it can be diagnosed organoleptically and by other means. The genuine halitosis is further divided into two, physiologic halitosis and pathologic halitosis, where physiologic halitosis is nothing but a transient disturbing odor caused by food intake like garlic, onion, etc. and medications and smoking and alcoholism, where these does not reveal any health issues. So when we look upon the pathological halitosis, is a persistent halitosis revealing some health issues. So what is pseudo-halitosis and halitophobia? The pseudo-halitosis is when a patient is convinced that they have a halitosis but which they really don't have, is known as pseudo-halitosis. And when a patient had a halitosis and they recovered from it but they still believe that they have halitosis, is a condition named as halitophobia, which should be reversed only by a psychological counseling. So when we come to the etiology, that is the cause for the halitosis, is in the majority the halitosis is caused due to the oral cavity, that is periodontitis, gingivitis or tongue coating, etc. But it is generally divided into two pathways. The first one involves increase in the certain metabolites in the circulating blood which escapes via alveoli in the lungs, and it is called as extraoral halitosis. And the second pathway, that is intraoral halitosis, which involves either increase in bacterial load or by the amount of substrate of the bacteria increases. All type of infections, ulcerations and tumors in our body can lead to bad breath. In a particular study, it is made clear that gram-negative bacteria in particular causes unpleasant smell by the production of sulfur. So when we breathe the halitosis, it is divided into three: genuine halitosis, pseudo-halitosis and halitophobia. The genuine halitosis is further divided into two, physiologic and pathologic. And the pathologic halitosis is further divided into two, intraoral and extraoral. When we look upon the examples of extraoral halitosis, it includes diabetes and gastric ulceration and any other health issues resulting in bad breath. When it comes to intraoral, it includes dry mouth, tongue coating and dental pathologies. Let us now see the intraoral causes in detail. The tongue coating. Innumerable depression in the tongue is an ideal niche for the bacterial adhesion and growth and sheltered from cleaning action. And moreover, the desquamated cells and the food remnants is also trapped in the sites and consequently can be perforated by the bacteria. The fissured tongue and the hairy tongue has even more rough surface. Periodontal infections. In periodontal infections, not all patients with gingivitis and periodontitis have bad breath, and there is some disagreement in lectures as to what extent the oral malodor and the periodontal infections are related. But patients with periodontitis and increased interdental pockets and increased food impaction in those pockets can lead to malodor in a higher range. Dental pathology, that is, the causes leading only due to dentition, are deep caries lesion with food impaction, extraction wound with blood-filled clot, and even in dry socket it causes malodor, and interdental spaces filled with food impaction can cause malodor, and crowded dentition which has a large favor of food impaction and food entrapment which leads to malodor, and the acrylic denture, especially when it is not cleaned properly and continuously wear for a longer period, it may lead to malodor. Dry mouth. Saliva plays an important role in cleansing effect of the oral cavity. When the patients with xerostomia, that is reduced salivary excretion, it results in increased plaque accumulation in the tooth and extensive tongue coating, which increase the bacterial load, which leads to escape of sulfur components, and on drying of the saliva, we experience a strong malodor. Diagnosis of malodor that include many techniques, that is oropharyngeal examination, organoleptic rating, gas chromatography, dark field or phase contrast microscope, salivary incubation test, and electronic nose. And when it comes to self-examination, it is better not to test yourself in the home without consulting a doctor. After consulting a doctor and following their advice, we can follow this self-examination for motivation and to come out of halitosis. If you are following these instructions without a dental consultation, it is going to develop a pseudo-halitosis or halitophobia in your own, and it may affect psychologically. Self-examination is nothing but smelling one's own breath by exhaling on the hand kept in front of the mouth. It is irrelevant because the nose is getting used to the smell of the skin and the soap used for hand washes and the sanitizer smell. We can follow other types for self-examination is smelling a metallic spoon or non-odor plastic spoon after scraping the back of the tongue, and smelling a toothpick after introducing into the interdental area, and smelling saliva, spitting it into a small cup or a spoon, and licking the hand and let it dry and then smell it. Treatment for malodor, which is centered to reduce the bacterial overload and micronutrients by effective mechanical oral hygiene procedures which include tongue scraping. Masking of malodor, which includes mouth rinses, mouth sprays and lozenges with pleasant odors, which is a short-term effects with no antibacterial effect on the oral cavity, where these does not cure the cause of malodor, it just masks the malodor. Mechanical reduction of intraoral nutrition and microorganisms, that is, the bacteria get accumulated on the dorsum surface of the tongue, which is reduced by tongue scraping, and it not only reduces the tongue coating but also reduces the amount of bacteria accumulated on the tongue. Chemical reduction of microbial load, where along with toothbrushing, mouth rinsing also became a common oral practice. Only the formulation has been changed for the malodor patients with antimicrobial agents and oxidizing agents to reduce the activity responsible for malodor production. The main ingredient is antimicrobial agents such as chlorhexidine, chlorine dioxide, essential oil, amide fluoride, stannous fluoride, baking soda and triclosan, where these mouthwashes should not be used without a dental consultation, as these may differ from patient to patient as per their needs. If the malodor is not related to the intraoral conditions, a multidisciplinary consultation should be made for the patient to overlook other health issues and problems related to bad breath. Thank you for watching this video. Please do like, share and subscribe for more informative videos.